Hello, I'm Dr. Scott Donkin with Donkin Chiropractic, and I'd like to discuss with you something that is very real in my office and I'm sure elsewhere in the community and in the country and the world. And that is unmasking neck pain. I see a lot of people, and we included, wear these masks in order to be protected and safe. But what I've noticed is that people have an increase in two things. One is they have an increase in neck pain. Another thing is they have an increase in anxiety. So what happens in this particular one, I think it will show very clearly, is that this part of the mask, especially if it's out away from the cheeks, causes a person to lean further forward to view their tasks. And that exaggerates a poor neck posture. And if they do that repeatedly or for prolonged periods of time, it can cause a lot of pressure, extra pressure here, across the neck and shoulders, even into the arms and even into the mid-back. So what you can do to help this out is, number one, recognize that this is an issue. And so take breathers when you can, which is, for example, when I'm sanitizing the table between patients, I'll just take this off and take a breather so that I'm not continually having to have the mask around my face. Because breathing causes more restriction and causes a little more tendency to have stress and neck tension. The other thing is, if the bridge of the mask is positioned more closely to the cheek and the nose, then you can look over in a better and healthier way. Now, all masks are not created equal either. So if you have a mask that breathes easier or that you can see over better, then tend to use those masks for the longer periods of time that you need to use it. Again, you can unmask neck pain. It does not have to cause you as much trouble as it's causing people now. I'm Scott Donkin with Donkin Chiropractic.